guys, Dr. Will here. We're back with Jimmy. So in the last video we got him all adjusted, so he's feeling pretty good. The nerves are flowing, but now we need to address the muscles. So for those of you that follow me on social media, or those of you that have been a patient in my office, you know that my soft tissue tool of choice is active release technique. It's something I've taken tons of courses in, and to me it's really the best way to clear out muscle stiffness because it involves patient movement as well. So unlike just a passive massage or something like that, active release actually involves the patient, and I find that it creates some lasting effects. Now, if Jimmy came in every time and he just got adjusted but we didn't actually address the muscles are going to pull the joints back to the position that they're used to, right? That's one issue with going somewhere where all they do is address the joints. The body is unfortunately not just a skeleton, right? The body is a nervous system. The body is a muscular system, right? So we have to really address all the systems if we really want to fix the patient and fix the issue. That's why I take this kind of three-tiered approach to treatment. So the first muscle that we're going to address is maybe the biggest problem muscle that we have today in this country, which is the old upper trapezius. Just about everybody, if you push on these muscles, they're going to feel some sort of soreness, and you're likely to feel some trigger points in here, okay? So we're actually going to start by treating the right side. That's what I'm feeling a little more tightness in. So I'm going to have Jimmy drop his head to the right. I'm going to take my depth and tension here, and then I'm going to have him bring his head all the way to the left. I'm just going to stretch that out. And I'm not being shy here. We're putting some serious tension through here. Good. Go to the other side. And again. Look away a little bit for me. Good. That way we can hit the levator a little bit. Okay, come on back. Right to left. Let it drop that right shoulder. Good. After I do that, I'm just going to bring him here. Make sure that we get a good stretch. Drop the shoulder, drop the head. This is a great stretch you guys can do at home as well. If you don't have access to a chiropractor that does active release technique, you can stretch, you can foam roll, you can use a lacrosse ball and still make some changes to the soft tissue. Now we're going to do the other side, so let's go left to right. Put some depth and tension. Bring your head to the right for me. Good. I got a good one in there. Left to right. Good. Left to right. Nice. And we're going to finish off with a little stretch here. Just have him drop his head. This muscle really tends to get tight for people that are either stressed or working at the computer or working in front of a screen all day. So it's really important that we take some time to treat this muscle, the upper trap here. Okay, so now we're going to work on the rhomboid. So the rhomboids are in between the shoulder blade and the spine. So if you ever have like a knot in the middle of your back and you just feel like you want to rub your back on something, likely you have some kind of issue in the rhomboid here. So this is the next thing that we're going to treat. And if we open the rhomboids, that's going to help us put Jimmy in a really good position here where his shoulders are back, his chest is tall, and he's feeling better in his spine. So I'm going to have you do kind of like a bench pressing motion. So you're going to just kind of press straight out like that. Okay. Go ahead. Good. We can also help mobilize the rib heads here. So if you're someone that gets, if your ribs get out at all, if you feel pain with inhaling or exhaling, this can help a lot with that. Good, one more. Good. Let's go to the other side. Same thing. Really try to pull that shoulder blade away, Jimmy. There we go. Let's do two more like that. Yeah. Hold there. Take a big breath in. Exhale. Good. Okay, now I'm going to have you give yourself a hug. We're going to work on the erector spinae. These are these muscles that are on either side of the spine. We're just going to stretch these out. So I'm going to have you roll down towards your opposite knee. I'm just going to follow you. Got it. Good. Roll down. One more. Nice. The other side. Roll down. One. Good. Okay, relax your shoulders for me. So now everything through the upper back, through the shoulders is a little bit looser. The last area we want to treat is going to be up here in the suboccipitals. These are the muscles that often contribute to tension headaches. So we were able to make a really good change in the joint here, but we just want to make sure that the muscles are doing what they're supposed to do and they're nice and stretched out. Okay. So we're going to go here. I'm just going to have you look to your right. And all I'm doing is applying a little bit of pressure to these muscles. And this can really help people with headaches, migraines, jaw pain, neck pain. My jiu-jitsu comrades out there, I know you're hurting. Even if you're dehydrated, these muscles can become really, really tense. Patients will always be surprised when I ask them if they've had enough water, and they're like, no, I haven't. Well, usually I can feel in their neck how hydrated they are just based on the quality of the muscle. So turn your head to the left. Good. We're just going to move all the way down and just make sure everything in the neck is moving really well. All the way down. Good. Last but not least, I like to hit the area with the Hypervolt. Now, what the Hypervolt does is it really gives the nervous system a really good sort of blast of input. So I really like to use it at the end of treatment just so the body kind of can hit the reset button on everything and really absorb all the treatment that I did. It's not going to be as effective, of course, something like active release technique and actually making a mechanical change to the muscle, but it can be really effective at just kind of getting the whole body into a state of relaxation, parasympathetic nervous system, and everything like that. So we're just going to hit over all the areas that we were before, all the way up and down the spine. We can go down to the low back. Again, this is all about just kind of making the nervous system feel safe and getting Jimmy ready for the third part of the appointment. We're just going to be moving his body and really hitting the save button on all the treatment that we've done for him. All right, how you feeling, sir?
Great.
Doing good?
Yeah.
All right, so like I said, that's part 2 of 3 of Jimmy's treatment here at the office. Part 3, I'm going to show you guys some exercises that we use to open up his upper back and to strengthen his shoulder blades. So tune in. Don't forget to like, comment, and subscribe. Make sure you keep notifications on because we have another video coming next week.